dial. This is James Slim Overton, and I'm here with my host, Leah Drake Stitt and Thomas the Colonel Chapman. And we welcome you this Monday morning on the Seven Cities Forums presents Portsmouth Coffee Talk. And this morning we have a special guest. We have Dr. Paula Harmon Boone. And she is one of the first Black female optometrists in the city, not the city, in the state of Virginia. And good morning, Paula.
Good morning to everyone.
Good
morning. Before we get to you, we have this thing we've been doing and honoring Portsmouth women. So Leah, if you will.
Just 1 minute. I apologize. Computer it's not doing what we would like for it to do this morning. Would you go ahead and get started, James? And then I'm going to have to do this a different way because for some reason it's going to my old Facebook page. So
okay, no problem.
you can start with Paula, and then I will come in. Okay.
Our special guest is Dr. Paula Harmon Boone. Of course, she's a retired optometrist. Wanted to give you an ophthalmologist, which is different. You explain that later. But she's retired. She Portsmouth native, attended I.C. Norcom High School, class of 71. 1 year before the greatest class, 72. But that's debatable.
For shame.
You know how we do. But anyway, she's a graduate of Virginia Union University in Richmond and majored in biology, one of our HBCUs, studied optometry at Indiana University. And before she retired, she was, supervisor of optometry of the optometry department / coordinator of Norfolk Naval Shipyard Site Conservation Program. Am I correct? That's a mouthful, you know. We're busy. But before you get into your program, Paula, it's kind of interesting how you got into optometry. When you went to college, optometry wasn't on your radar, but while you were there majoring in biology, what happened to sort of steer you into direction of optometry?
Actually, I was part of the pre-health allied program clubs and the Virginia Unionites out there. I was in Dr. Tony's class, and we would have a pre-health club meeting in the evenings, and two local optometrists, brothers actually, in Richmond came to our meeting, Dr. John Howlett and his brother Fillmore Howlett. They talked about the field of optometry, and I became interested from their talk. As a result, I applied and was accepted at Indiana University. Two of my senior classmates were there, Lucille Washington and Adrian Mitchell, and they were accepted at IU and said, if you come to IU, we'll sort of look out for you, which they did. So it was because of two African-American male optometrists. Actually, Dr. Howlett was the founder of the National Optometric Association, which is the minority association for optometrists in the country. So he came and his brother, and then I was also mentored by Dr. Benjamin Lambert, who was the senator of Virginia, and he was one of my mentors as well. So I had great mentorship, great recruitment, and found out that it was the perfect profession for me.
Oh, okay, thank you. Leah, I see you're live and your picture is.
Yes, it's turned, well.
Okay.
Okay, we're gonna turn this thing around.
Okay, thank you. So Paula, so where did you go from there? You know, once they came there and gave you that presentation and you got the chance to see some optometrists that looked like you, was that sort of the turning point for you?
It was. Because my senior year, I had an opportunity to go to their offices. All three had private practices in Richmond. I was able to go to their offices, spend time with them, get a pretty good idea of what they did, what the profession was about. So that was the turning point, actually. Their recruitment and actually them sharing with me in their own offices was a great opportunity. So I applied to IU, was accepted, graduated, and came back home, and then actually worked with two African American ophthalmologists. Worked with Dr. Arthur Wong, and after his passing, I worked with Dr. Joseph Coffin in Norfolk Eye Physicians and Surgeons, and with Dr. Richard Sherrill. So I stayed with them, I guess, for about 8 years or so. And then my sister-in-law happened to see that they needed an optometrist in the shipyard. And I, of course, didn't think too much of that at the time, working with the ophthalmologist. And she said, well, go ahead and apply. I did on a Friday. One of my IC Norcom classmates was in the HRO office. She said, Paula, I'll make sure your application gets scanned before I leave Friday evening. She did, and they called me Monday morning. The rest was history. I went that Monday. They said, you were the first and only applicant that we've had for this position, and it had been open for 6 months.
Wow.
So you say, what God has for you is for you.
It's for you, that's for sure.
Yeah, so I went in, applied, and I stayed there for 30 years.
Ooh.
Best opportunity, great camaraderie among my comrades. And I have to say that being the only African American and the only female in that position, I worked with Caucasian, Navy, male officers. And I have to say that they valued my position, and I felt included in meetings and affiliations that we had as a civilian optometrist with the active duty. So it was a great office, a great position. I enjoyed the work that I did with the civil servant employees, making sure that they were visually efficient to do their jobs in the shipyard, working with the Naval Hospital as well, and the other naval clinics in the area. So it was great. I had a staff of one other optometrist, two technicians, and a receptionist, and it was a family because most of us stayed together for 25 years or more. So it was a great opportunity. And they say when it's time to retire, you know. So after 30 years, I had my daughter graduated from law school. I said, it's time to retire. So I've been out since then trying to recruit African Americans into the field of optometry just the way I was recruited, because now the numbers are even smaller than when I started. Most students now going to optometry school is about 3%, where you have other minorities, Asians are 30%, Hispanics are 7%, but we're at 3%, even going to enrollment into the schools. And as far as practicing, we're like 1.8%. So our numbers are abysmal in terms of the profession. And it makes such a difference in terms of the kind of treatment that we get. Cultural competency is a critical factor. You need to be serviced, and studies have shown that when you go to a physician who looks like you, who understands your culture, who will take time to talk with you, get your history, it makes a difference in terms of our treatment. It makes a difference in terms of our survival. Case in point, you can go to an optometrist who may not look like you, who will not take time with you. Say if you go and you may have had an increase in your prescription, and that prescription may be that you're more nearsighted, and the doctor may say, oh, you've had a change in your prescription. We're just going to write you this out and give you some new glasses. But if you take time to talk with that individual, you will see that there may have been a change. It was a sudden change. You need to talk with them. Mr. So-and-so and Miss So-and-so, I see that you're diabetic. Have you taken your medication? When do you check your blood sugar last? Because elevated blood sugar can change and increase in your prescription. So for those who are not interested in that, they would oftentimes miss that opportunity, which will affect the visual health of that individual and his life down the road, because it was a change in the prescription, not due to anything within the eye, but it could have been a change due to elevated blood sugar level. So when you have individuals who are culturally competent, who look like you, who are concerned about you, they're going to ask those critical questions. And that's going to make a difference in your treatment. That's going to make a difference in your survival.
Paula.
Wow. And let me make these points before. One thing, the Colonel is with us, but he's sort of blacked out, so he's there. So if you don't see him, the people that are watching on Facebook, the Colonel is with us. And another point, Leah, before you, I know you have a question. I wanted to make sure the people that's watching on Facebook noticed that Dr. Boone has a very important background.
Oh, here we go. Here we go. Here we go.
About a couple of weeks ago, I told my co-host, and people that were watching, be ready in a couple of weeks because I had something for you. Because most of our guests, and nothing wrong with that, have been Norfolk State Spartan grads. So wanted to make sure that we represent other HBCUs, and today, Paula, and also she's kind of a legacy because Paula, I believe your father went to Union. Your
Brother,
Union.
yes, we're Unionites. Generational Unionites.
Yes, yes. So it was like a path already woven out for you before you went. But of course, we honor all of our HBCUs. So I just wanted to mention that, and all of our HBCUs, make sure you consider our HBCUs because you can see the success stories that come out of these universities.
Exactly.
Yes, yes.
So Paula or the Colonel, if you have a question.
Yeah, Dr. Boone.
Yes.
Glad to see you there. It's a rarity because our numbers in optometry, in the field of optometry, are so small.
Yeah.
I used to recruit healthcare professionals for the Army for a number of years. And what I'd like to ask you is, say, young folks coming up, and we used to use what we call health professional scholarships for the military to get folks through, to pay their way through school. For young folks that's in majoring in biology or chemistry, what is the GPA that they'll need to get into a school of optometry, and what is the starting salary? If you could expand on that.
Okay, it's very competitive now because we are fighting against so many other minorities, and where monies and scholarships and all were just for us, the characterization changes or categories is now underrepresented minorities, and many times that includes us, but there's so many that will latch onto those scholarships before we even start to apply because you have those other categories. So looking at the numbers, the starting salary is usually around 125, 121, starting going into the military. But for private practice, the salary can be as much as 250,000, 270, 280, depending on how hard you want to work in terms of your practice, how smart you are about your business management practices. So the numbers are down. I've been going around to our HBCUs because we feel like with those schools, we can have a pool of qualified applicants. I'm not only going to Virginia Union, but Norfolk State, Elizabeth City, Virginia State, Hampton. I was instrumental in having what we call an articulation agreement between Hampton and Salis College of Optometry, where they have promised to set aside certain seats for Hampton graduates to increase the numbers. Technically, they're looking for a GPA of about 3.6. So we need to start telling them early. They're looking for good grades, good GPAs, and OAT scores, which is the entrance exam into optometry. You want at least 300 or 320, 325 is good. Along with that, they want you to be well-rounded in terms of your extracurricular activities, volunteering, shadowing opportunities, leadership positions that you had. So it is a competitive field, just like with any other health professional field. So they're looking for top students who have been active in their undergraduate journeys, who are well-rounded, who are altruistic in terms of their accomplishments, including volunteering. So to answer your question, 3.6 and above, and around 100,000.
Mhm. You know, the other,
More.
the
Paula,
last thing,
okay,
Yes.
go ahead, Colonel.
okay. The last thing, they don't have to take a, like in the physicians have to take a MCAT or anything like that, do the entrance exam, or do they?
Yeah, that's the OAT. And
ONT.
that's, yeah. And
Good.
now, some schools are taking the GRE, which is interesting. And we have one school that's not taking any entrance exams. But to me, that is a discredit to the student because you are reducing more, um, more attributes of the student that you're not looking at. So we want you to look at the test scores, look at the GPAs, look at their involvement as when they were in school. And when you take away those, any of those elements, to me, you are doing a disservice to the student. But yes, there is an entrance exam that most schools, and it's called the OAT, the optometry unit admission test.
Paula,
Yeah.
I too had the pleasure of working with Dr. Benjamin Lambert when I was working in
Mhm.
Richmond in the General Assembly, and he was a fine gentleman, I tell
Yeah.
you, at all
Yeah.
times. So I know that had to been a great experience. But Paula, one of the questions that was asked of me yesterday, and people wanted to know the difference between the optician, optometrist, and ophthalmologist.
All right. The optician basically is an individual who works with the optics of the lenses. They're the ones that grind and manufacture your glasses. They many times are the ones that do the fittings uh, for your glasses because there are measurements that need to be accurate to determine that that prescription is suited for you, that's measured optically correct, and you get the best benefit from that. The optometrist is a health. Some have gone into the physician aspects of it, but basically we are doctors of optometry. The program is a 4-year program, very similar to what a dentist or an podiatrist would be involved with. In the state of Virginia, there are several um, opportunities that we have in terms of uh, injections. We do your basic comprehensive exam. We are now certified to treat glaucoma. We can also do superficial um, treatment for eye injuries, which I was able to do. An industrial optometrist, I was able to remove foreign bodies because the shipyard workers and the environment that they work in. Um, so the scope of practice for an optometrist has expanded greatly over the last 10 years. Many times when people think of being an optometrist, they think now, oh, well, you just fit glasses
Your
and do
glasses.
contact.
Mm-hmm.
But it's far beyond that now in terms of what we are allowed to do. If you notice, even this week, optometrists are now being allowed to do injections for the COVID vaccine.
COVID vaccine, yes.
So our scope of practice is greatly advanced. The ophthalmologist is first a medical doctor who has done a 4-year um, curriculum, and then they will go into a residency or a specialized field of medicine, which would be ophthalmology. So after that, they will do another 2 or 3 years of residency to specialize in the eye.
Mm-hmm.
So you do have 3 distinct careers with the optician, basically with your glasses and putting a contact lens. your optometrist being your primary care doctor. Many times they will go to the optometrist first. We will be the ones to diagnose anything that we see. That which we cannot treat in the scope of practice, we would then refer you to an ophthalmologist who would do further treatment that many times would call for a surgical intervention, like the removal of cataracts, laser treatment for diabetes or for other systemic issues that occur.
Thank you so very much.
Does that make it pretty clear?
Yes.
Dr. Boone, I know you have a presentation, but I
You
want,
keep talking.
one of the reasons that the numbers are low is because we talked about when you were on the show before, how some people don't feel like optometrists are real doctors because of their locations in shopping centers and malls, and you don't see other doctors in those places. And another thing, a lot of the HBCUs don't have pre-optometry.
Mhm. That's correct. And I'm working with that.
You mentioned in Richmond, VCU had one.
Yes,
You hadn't been able to find one in the HBCU, which would be
very
important, which exposes freshmen to
right.
this profession.
Mhm. But that's absolutely correct.
Mhm.
And many of those VCUs, many of them are Asian, Hispanic, Indian, but no optometry. They realize that it is a viable, important profession for the community and for their own people. We need to understand that. So that's part of my recruitment effort is to make sure the pre-health advisor understands the importance of the profession, how much is needed, how much we need to do, how much our scope of practice has actually advanced because they are still stuck in the commercial setting. But you need to have a comprehensive exam and you need to have certain things that you would expect when you have a comprehensive exam. Many times, excuse me, in the commercial settings, you don't get that kind of an examination. It should include not only refraction, but you should also have a dilated portion of your exam. Basic photography should be done to establish a baseline in terms of your visual health. Some of them use what we call an optomap, which gives a scan of the inside of the eye and creates a permanent record that can be referred to when you go back to your doctor. If you go to the commercial setting, many times they don't have time to do that because that's not their main focus. Many times they will not purchase the equipment or the devices needed to do these scannings because they're very expensive. And many times their main purpose is to make money. So that leaves our health at risk. So that's why we need competent optometrists who look like us, who are certified and qualified to practice the full scope of what's allowed in the state where you are practicing. So yeah, there's a lot that needs to be done. The HBCUs need to be educated. I'm trying to do that as much as I can and move that into our national organization. Now HBCUs are in the limelight, so we're getting a lot of coverage. So we're pushing that agenda to make sure that optometrists out there, they understand what we do and why it is so important and why it is vital to the African American community. Because many of us are losing sight, but we don't have to because people are not thorough, they're not competent, they're not really concerned. So we need that to be understood, and we're teaching that to our students. So when they come out, that they will give us the competent and professional treatment that we deserve.
Yeah, because a lot of those diseases are, as far as African Americans, are generational, especially
Right.
glaucoma. It's something that
And
is
and
in your,
we'll
you stand the chance of,
lose sight.
contracting. So
Right.
you have to
Same
know,
with
so you
glaucoma.
have to know what to ask for, what to look for when you go to the
Uh,
optometrist.
right. When you for glaucoma, like you said, everything is disproportionately affecting us. Always higher numbers in
Always.
diabetes, numbers in high blood pressure, numbers in glaucoma, and many of us are losing our sight. We are dying when we don't have to because we are not receiving the proper treatment. So when you go to your eye doctor, make sure you get a comprehensive exam. Make sure you get a dilated exam. Make sure they look into the back of the eye. Talk to them about your medication. Let them know if your blood pressure, if your uh, blood levels are under control. Um, so, and when you get your exam and they tell you, oh, everything's fine, ask for your numbers. Ask for it. If you check your eye pressure, find out what your numbers are, write them down. And don't just take everything is fine. Know your own numbers for yourself so that when you go back again, you can say, well, doctor, my eye pressure was 18. This time it's 21. It seems to be elevated. What needs to be done? There is a history of glaucoma in my family, and I understand that I am at risk of losing my sight. But if you don't have someone who's competent, who's going to take the time, those opportunities are going to be missed, and the sight is going to be affected. And once it's gone, it's not retrievable.
Mhm.
Yes, you are so correct, Dr. Boone. You know, I think the stem of the problem of having the shortage of minorities within or Black minorities in optometry stems with our address of minorities in all or exposure to all the uh, health professions. You know,
Yeah.
young kids to go to school. I want to major in chemistry and biology. Those are the two feeder groups for, and we always talk about med school. But we don't know about optometry or podiatry, OTPT, and those other great professions for healthcare. And so we need to have that exposure. And so I got to congratulate you to go out, that you're going out there and talking to some of the kids and saying, hey, this is a viable career field that we need you to undertake. So thank you ahead of time. But before you go on, I need to put a little commercial break in here and talk to our folks that are out there. And if you like what you're hearing, Hampton Roads 7 Cities Forum is trying to expand our program. And we're looking for sponsorships and or donations. And you can send it to Hampton Roads 7 Cities Forum at P.O. Box 7664, Portsmouth, Virginia 23707. And if you would like to give us a shout out and tell us how we're doing, we have an email account that you can send us messages from, and Slim will give that to you. Slim?
That's Hampton Roads 7 Cities Forum at yahoo.com. Hampton Roads 7 Cities Forum at yahoo.com. And I want to say we're coming up on the 7 o'clock hour, and I think we'll probably be on the radio a little longer because of the engineers, what's going on at the place. But anyway, I'd like to give Leah, if she's ready, an opportunity to honor one of our Portsmouth women.
I am indeed ready, and I do apologize for earlier. It looks like when things go wrong, they go wrong all around. But anyway, we will move on.
Moving on, just like the Colonel.
That's
gave
right.
a strong message, even though we don't see him.
Even though we don't see him. But during this Women in History Month, we, the 7 City Forum, would like to salute Clarine Baldrick Roberts. Clarine Roberts is a retired associate professor of business education at the great Norfolk State University. And prior to that, she taught at the great I.C. Norcom High School for a total of 35 years as an educator. She is a native of Portsmouth, Virginia, and is a product of the school system and graduated from I.C. Norcom High School as valedictorian in February of 1948. Her college education was pursued at Norfolk Division of Virginia State College. There you are, Virginia State College, and Virginia State College in Petersburg, Virginia, graduating as valedictorian again and receiving a Bachelor of Science degree in education. Further study was at Teachers College in Columbia, at Columbia University, New York University, and Virginia Commonwealth University, finishing with a professional diploma. She's been an active member of Zion Baptist Church for almost 80 years, and she's been an active member of Alpha Kappa Alpha sorority for 70 years. So on this morning, during Women in History Month, we would like to salute none other than Clarine Baldrick Roberts.
Yeah,
If
great.
you're here in the community,
Professor
folks,
Roberts.
tell her how much we appreciate her if you see her in the community.
I said I was going to do this before we get back to Dr. Boone, that we always talk about Narcom. A lot of people that come to go to Narcom, but the colonel, our own colonel, went to Western Branch High School, and we don't want to ignore any of the high schools. And Western Branch has produced some great people as well. And kudos to the colonel, a graduate of Western Branch High School, who was it was a great teacher there from I.C. Narcom, Bernard Griffin.
How about that?
So you can't get away from Narcom no matter what happens. But anyway, just wanted to mention that. Didn't want to leave out the Colonel High School because we all are proud of where we got our educations from. But he ended up at Norfolk State. So
Yeah. And Hampton.
and Hampton, yeah,
Hampton.
and the U.S. military.
Well,
So
Dr.
we can
Boone,
get back to our guest.
the group that you are you doing this as a lone optometrist going around to these schools, or is there a group that's involved? And if there is a group, has there been a thought to go and talk to the high school seniors and so that they can be thinking about this prior to going off to college?
Yes and yes. I started out locally, but and started with the undergraduates. But I am working with the National Optometric Association, which is the Association of Minority Optometrists. It has a student component, which is the National Optometric Student Association, which actually has chapters in most of the 23 schools of optometry. There is a social media group that just came on board. I'm excited about them. They're two Black brothers who got it started. It's called Black Eye Care Perspective. For those who may be interested, they can go online. They have a pre-optometry club, social club, which I'm also active with. They meet the 13th of each month. When these two brothers started, they went to the institution of eye care, schools of optometry, opticians, the optical industry, and said they really want to promote 13% of optometrists, faculty members, students, and all, because that's basically what our percent is in the United States, African American or Black is 13%. So they came up with the 13% promise idea. So this is really a campaign now of the National Optometric Association, Black Eye Care Perspectives, and other groups who are helping us. So it's kind of a concerted effort. But to you, answering your question, when I first retired, then it was on my heart to go to Virginia Union, and then of course to Norfolk State, and to Hampton, and Virginia State locally as a regional representative of the NOA. So the thing is, now we need more mentors, we need more individuals, because this is going to be a marathon. It's not a sprint, and it's a lot of work to lead, and we just need more people in this process. So anybody who's interested, go to the website for Black Eye Care Perspective, go to the website for the National Optometric Association. Like I said, it's not that many of us. I think it's more in Virginia than in most states, because we do have Dr. Troy Morgan, who's in Virginia Beach. We have Dr. Tanya Edie, who's in Chesapeake. We have Dr. Christina Ramsey, who's in Portsmouth.
Yes.
We have two, Dr. Lisa Wallace Davis in Hampton and Dr. Tanya Long, who's in Newport News. So there are a few of us locally, but they're busy with their practices. Now I must admit, now that I'm retired, I have a little more free time than they would. But we are working together, and it's going to be a challenge because of working with HBCUs, trying to get them back on board with the advancement of the profession, and then just finding more mentors to lead these students to, because they need places to shadow, and they're
Right,
not that many of us.
right.
And so we got to work together.
And
It's a daunting task.
right, and just one small question here. In light of the fact that we're spending so much time on computers now, it's even more necessary for us to have more exams due to the fact that this light on this computer is just destroying us.
Right. Right. That was part of my presentation. And if
Okay.
we don't have more in the air,
No, but we still have time for your
I can go
presentation.
to real quick.
Yes,
Do
we
we
have
have
time.
time?
James,
Yes, yes,
start
go
a
ahead.
Okay.
presentation.
All right. I just want to talk a little bit about digital eye strain and Zoom fatigue, because
Yes.
we're in this pandemic. Everything now is excessive. The impact is great. Let's see if I can share my screen. It's not going to do right, is it? Share.
Hopefully yours yeah, you're there. You're there.
Okay, here we go. Let's see if I can get. Uh-oh. Oh
It's good.
no. All right, digital devices. Everybody's using them. The children in school, parents, adults, and during this pandemic, everything is excessive. Our exposure is exponential. Digital eye strain is a physical discomfort after prolonged exposure to digital technology. And we know right now it's excessive. And this exposure is a shock to our visual system, and it causes headaches, blurred vision, eye irritation, sensitivity to light, neck, shoulder, back pain, and difficulty even concentrating. One of the things we can do is called the 2020 rule to reduce the effects of digital eye strain. That is to take a break for 20 seconds, look at something 20 feet away, and do so every 20 minutes. When you have school age children, those numbers change to 10, 10, 10. Same thing. Take a break for school age children every 10 seconds, look at something 10 feet away for every 10 minutes. And for preschool children, it rule goes down to 5, with a maximum hour time on any digital device of 1 hour. And for school children, maximum time of 2 hours. Now, those are just basic general guidelines, but now with the pandemic, the kids are on school on the devices 6 to 8 hours, which is um, excessive. The World Health Organization recommends children under the age of 5 only spend 1 hour on digital devices, but we know that's not true, because you have kids on devices all day long.
All
And
day.
anyone under the age of 1, they recommend they should not be on any devices at all. And we know that kids now, 6 months old, they're sticking something in their hand
That's
to
true.
look at. And it affects their motor skills, it delays their development, their vocabulary and communication skills, their cognitive control, problem solving skills, creativity. All of this is reduced as these children are on these devices for excessive hours. We're doing damage to their development. But many times people find it easy instead of taking time. And many don't have the time because they're trying to survive. They'll just stick the phone in the hand or these little toys, and the kids are on these devices all day long. But we're doing them a disservice because it's detrimental to their development. Ways to prevent some of these problems, in particular when you're on your computer, is to eliminate your screen's glare by changing the position of your screen. You can do that. You can adjust the brightness on your screen, reduce the amount of light in the room so it'll match the light illumination on your screen. You can adjust the font size. Request a prescription. So when you go to your doctor, tell them I'm doing a lot of work on the computer, and you can actually get glasses that are set for that working distance for computer use, which will help reduce your eye strain. Many times when you're on computers or these devices, you have a tendency not to blink, which causes dry eyes. So you need to exaggerate your blinking. Many times you can use artificial tears and supplemental omega fatty acids as combinations of omega 6 and 3 have been known to help with dry eye syndrome. And we're finding dry eyes with children because they're on the devices too soon, too long. Many times you think of dry eyes of people who are older, women in menopause, um, people in certain work environments. But we're finding children are having dry eyes, and that will affect their blinking. The actual glands will stop uh, uh, rejuvenating as they should. So it becomes a serious problem when you have dry eye because when that affects the health of the eye, the surface of the cornea. So there's so many issues associated with this that people don't really consider, and they see the children rubbing their eyes many times because it's irritation, dry eyes associated with excessive use on these devices. Because posture makes a difference. The issues with the neck, back, and shoulder problems. You can see the little boy down in the corner or the young lady at the top. Many times it's posture that makes a difference. When you're at your computer, you can either be too low, too high, too close, or too far away. And all of that is going to make a difference in your body posture. Did we not know when you're texting, as you tilt your neck down, that creates a force on your neck, which is equivalent to 60 pounds if you're at 60 degrees. If you see the diagram, the last one, that's equivalent to 60 pounds on your neck. And if you do that all day long, of course, you're going to have spinal issues, spinal curvature, which develops. And with children starting at such an early age, this is going to vastly affect them as they get older. Um, Again, check your posture, the height and position of the device. You sit upright with good supine support. The screen should be an arm's length away from you, and your smartphone should be held at an angle slightly below eye level that doesn't cause the head to tilt down. This is just kind of a diagram of how the correct posture when you're sitting at your computer, and many of us are sitting there for long hours now. And when we're not in a good posture position, when you get up, you're going to be extra sore, tired, and have other issues there. Uh-oh. Zoom fatigue. Now, that's a new term. It's associated with your body and mind exhaustion due to video chats and conferences. We've been doing that now 24/7.
That's right.
Day and night. You're working in the day, you're meeting at night, and all of it's done on Zoom. It does make a difference. Professor Jeremy Ballinson, he was the founding director of the Stanford Virtual Human Interaction Lab, examined the psychological effects of spending hours and days on video conferences. And in an article published in this past February, he found 4 consequences that contribute to Zoom fatigue. Now, considering you already have eye strain issues from being on the device, then add Zooming to that, and these factors do make a difference. He says the excessive amounts of close-up eye contact is highly intensive. Normally, we are not that close to individuals when you're in a one-on-one workspace, but many are. So they recommend taking your Zoom out of the full screen option and reduce the size of the window. Seeing yourself, who would think, seeing yourself doing video chats constantly in real time is fatiguing because you wonder how you look, what you're doing, how you're sitting, how you position properly in the screen. Uh, he suggests use the hide side view option. During these video chats, you're not walking around, you're sitting all day long. They recommend turn your camera off and walk around the room if you can. And even during the process, the cognitive load is much higher in video chats because you're trying to read the reaction of the person you're talking with. And you have 6 or 7 people you're trying to view at the same time. It can be mind boggling. So he suggests give yourself an audio only break sometime. So these are just some things that you can do to help mitigate some of those symptoms from Zooming all the time. Another big issue is the blue light exposure. With all of these devices that we have, your phone, your TVs, your computers, your laptops, your desktops, and with all appliances in your home, everybody is going to what they call energy efficient lighting. And that lighting has emitting diodes, and it's called LED, and it radiates wavelength lights between 415, 455, and any of those wave blue light emissions displays on the background from these devices can damage retinal cells and affect your overall general health. And we are inundated now. If you go to the stores, everything is LED
Right.
in your house, in your appliances, outside, indoors, everywhere. And we are getting excessive exposure to that. And even though it may be energy efficient, it is detrimental to our general health. Let's see. These are just the wavelengths. Blue light in itself from the sun is beneficial. Um, it helps regulate our circadian rhythm, the body's natural sleep and wake cycles. It boosts alertness. It helps your memory and cognitive function. It elevates your moods. But when you are under these lower level blue light emissions from all these devices, it is detrimental to our health. First of all, it disrupts our circadian rhythm. It depletes the amount of melatonin that's developed within our systems that allows us to sleep. So we are not getting the proper sleep because of the effects from the light. Digital eye strain, we've already talked about, associated with the blue light exposure. There's certain kinds of types of cancer that are can increase because of overexposure to LED lights. They found out that breast cancer cells can actually develop quicker because of overexposure to blue lights. You are at a greater risk of diabetes, heart disease, and obesity. It also affects us psychologically. More individuals, we find children are saying that they are depressed, that they are suicidal. Studies have shown a lot of this is coming from overexposure to blue lights, and it even can cause permanent eye damage, and some contribute. Uh, Doctors suggest that even age-related macular degeneration may lead to some uh, loss of vision. So blue light increases, as I said, alertness and suppresses the release of melatonin, which affects your quality and the quantity of sleep. It increases hunger and it increases blood pressure. So what do we need to do? We're exposed to these lights all day long. First thing you need to do is shut off all devices 1 hour before you go to bed. Don't work on your computer. As you can see here, people are in the bed on the computers. That makes a difference. Use the night shift phone settings. Many of our iPhones have these settings, and they are important. That makes the emissions warmer. You go to a red or yellow emission, and that does not have the effects as the blue lights. No TV on while you're sleeping. They have found again that decreases the melatonin even after you have cut off your device. Many people still sleep with the TV on. It is not good. They have found out even night lights, again, they have said can increase the advancement of breast cancer. So you need red and orange. Reading lights will help. And best of all, back in the day, is still the best thing. If you want to get rest, read a book, turn the pages before you go to bed. Do not use your Kindle or your e-reading books and that sort of thing. Don't do it. It's killing us. So there are several references. Harvard University has done a study on the blue light exposure. Um, there's a bluelightexposure.com that you can go to that talks about the effects of the light, but many don't push that. But it is something that is detrimental to us and is becoming even more prevalent. So you're wondering why the kids are behaving the way they're doing, why we are feeling the way we are feeling. It's not only what we're eating and lack of exercise, but it's also exposure to excessive exposure to blue lights. We talked about a comprehensive exam, what you need to do. Make sure you talk to your doctor about your exams, know your numbers. Make sure they do a dilated exam or an optomap, which scans the retinal tissues in the back of the eye, and it gives them a permanent record so that when you return, they will have something to compare to see if there have been any changes. So it's good to have that continuity of care. So if you've been to one doctor, it's good if you go back to them again. Just about Virginia demographics, 63% of Virginians are white. There are 659 optometrists. In Virginia, 19% of Virginia is Black. We have 42 optometrists. Asian is only 60% in Virginia, 6% population in Virginia, but there are 172 Asian optometrists in Virginia. That says something in terms of cultural competency and the kind of treatment that we're going to receive. This just exam by the scope of practice. We can do injections. We can perform surgical procedures. We can prescribe oral medications, including steroids. Optometrists can diagnose and treat glaucoma. We co-manage with an ophthalmologist on post-op surgery care. We can remove procedures such as foreign body removal and that sort of thing. And then at the bottom, we dispense glasses and contact lenses. But actually now, many optometrists who are practicing the full scope will allow the technician to dispense the glasses and fit the contact lenses. So again, as I said, the Black Eye Care Perspective, the Pre-Optometry Club, is there for high school juniors, seniors, undergraduate students in all disciplines, whether they're science or not. If we tell them about the profession, they may well go over to a science curriculum that will make sure that they get the prerequisites for admission into the schools of optometry. So Black Eye Care Pre-Optometry Club. And I know that was quick, but hopefully you got some information out of that. But again, main takeoff. When you go to bed at night, turn that TV off.
And I'm guilty, Paula. I'm really guilty.
I know. Those lights killing you in your sleep.
Yes, yes.
So,
Yeah, thank you, Dr. Boone, for that comprehensive presentation. And who knew that how much of your health is related to eye health,
Exactly.
and how much we need to pay attention to our eye health and do these preventative things before it's too late.
yes.
And you know, I'm an advocate of organ donation.
Mm-hmm.
So, and I know a part of the donations are parts of the eyes. So
Right.
what actually parts of the eyes are donated from a donor, and what can they do for the recipient?
Usually the cornea, and we have a very effective, prominent eye bank right over at Eastern Virginia Medical School, and they do a great job there. So corneas are needed. and they are very effective during transplant and can restore the sight of many individuals. So yes, uh, the organ donation, the cornea, and the eye bank right here in Norfolk.
Okay.
And one more question before the other host might have a question before we end up. You know, color blindness. I always had a question about that because sometimes being in the profession one time of tailored suits, and I would see people dressing, and some of the combinations they put together, I said that person must be colorblind. So color blindness is what exactly is that? Is that where people see black and white, or they just can't distinguish certain colors? Because
Usually,
some people, you know,
yeah, usually they can't distinguish certain colors. It's difficult to distinguish between red and green, but that's a genetic um, predisposition for that. It's very rare, but it does occur. Once it does, there's no treatment for it.
Mm.
They have found certain lenses, yellow lenses, kind of help the individual distinguish between reds and greens. It's usually shades of colors that they have difficulty discriminating, against. So distinguishing against. Um, but to be actually colorblind is very, very rare. It's usually just the fact that they have difficulty with shades of colors as opposed to actually not seeing any colors at all. But it is something that is rare. It does occur. There is no treatment. That's one of the things with working in shipyard. We needed to determine if an individual was colorblind because they have to deal with these codes with the wires colors. They want to make sure they have the right colors with the objects of what they were doing, because then that could pose a serious problem in the workment of the equipment that they were on if they didn't connect the proper wires with the right colors. So that was something that we had to screen individuals for coming into the shipyard, whether they were, color deficient as opposed to actual colorblind. So it's
because I've
usually
known
color
people that had to actually number uh, different things in their closet so they wouldn't, leave the house looking like a clown.
right. Well, some of that just has to do with class. Somebody might have distinguishing between a black sock and a navy blue sock. That happens to us
Yeah,
all.
yeah.
So that happens to me all the time. So
So we can work with that. That's doable.
And
Colonel, do you
Dr.
have?
Boone, nearsightedness versus farsightedness.
Nearsighted is when the individual's best sight is at near. That is, they can see up close without their glasses. Farsighted, depending on the extent of the farsightedness. Some individuals have difficulty seeing far and near, being farsighted. But generally, when you say farsighted, most individuals can see at a distance. Of course, when you reach the age of 40 and beyond, that sort of reverses itself. So you were nearsighted, that is somewhat of an advantage because you can take your glasses off and read up close. But you would have something, you need your glasses for distance. So nearsighted meaning your best sight is near if you're under the age of 40. And then
That's very true.
farsighted meaning your best vision, generally with if it's a small correction, is at distance.
Thank you.
Good point. Dr. Boone, I have one other question for you. Normally, for those that young children that are thinking about optometry school and say I'm a undergraduate at one of the great universities such as Norfolk State and trying to get into school. And so most of us minorities have to get through with loans. And so I always advocate if you're going to get loans, try to keep them down and try to get federally based loans rather than the private loans. Because one, what is the cost of, first question, what is the cost of the majority optometry programs since they're normally in private schools? And then the other piece is there an effect on if I'm default on my loans for undergraduate, does that preclude me from getting loans to get through optometry school on the other end?
Um, I don't think it precludes getting loans on the other end. I have not heard of anyone speak of that, or address that for students who are going for admission. They just have loans on top of loans, unfortunately. The curriculum can range anywhere from maybe 40,000 to 58,000 a year. Then you have to look at the equipment. The first year equipment they need might run about $3,000. But the nice thing about it is that there are some scholarships available for underrepresented minorities. We just have to apply early. You can get scholarships with your top GPAs and test scores. They do offer scholarships of that nature. The National Optometric Association, we give out $25,000 a year to students, 10,000, 7,000, 8,000. So there is money available as they matriculate through school. They just need to be vigilant, find out what's available and apply for that. Warby Parker just did, since we're in this Black Lives Matter environment, did a scholarship, full scholarship for 4 years for underrepresented minorities. So again, we've got to push to be in the number, to be competitive, make sure our scores are what they need to be, so we can apply for these positions. And there were some, and I think they still have some federal programs that will allow you to work in disadvantaged communities where they'll do a payback on your loan. So again, they need to be vigilant to research, if that work is available, that's something they can do to help reduce the amount of loans they will owe upon graduation. But there is money along the way. They just need to be vigilant and apply for those. And NOA is a good source for those loans for minority students.
Thank you.
Well, did I answer both questions?
Yes, ma'am. But I think that the answer on the default piece, if you do default in your undergraduate, you might be precluded from getting a federally funded graduate loan. It makes it more difficult. And so my point is to make sure that instead of defaulting on your loans, make sure you put it in forbearance, because if you're getting a higher degree, then you can put it on a federally based loan. You can put it on hold and don't have to pay it back till after graduation. So that's the piece there, because one, it affects your credit rating and destroys that if you let things go in default. That a lot of kids don't understand the impact of loans. Yes.
That is something. Thank you for bringing that up. Like I said, we're working now with the NOA and financial counseling, like you said, about loans. Should be maybe a part of that conversation as well. So thank you for bringing that forward.
Yeah.
Mm-hmm.
And I will address that. So when we talk with students, we can add that piece in there as well.
Yes.
Thank you.
Okay, Dr. Boone, we're really gonna have to end, but I must add this last thing because I think it's important. A lot of people are dealing with the readers now that you can get just about anywhere, which is probably good for what they're doing, but it doesn't compare with actually those exams that you really need, because you might get that temporary fix with the readers, but it might be something going on that only optometrists can detect with the dilation and other tests that you all do. So how do you feel as as an optometrist about the popularity or the people using the readers as opposed to getting their eyes checked first? Because I know it's a cost thing there for a lot of people, especially who have insurance.
Nothing compensates for a comprehensive exam. You must have a comprehensive exam to determine the health of the eye and your refractive error. The glasses that you get over the counter assume both eyes are the same. That may not be the case in your situation. It also assumes certain measurements that are generic, which may not be the case if you have a what we call a wider PD or smaller PD. You can get prismatic effect, and when you put those glasses on, they can cause headache because they are not measured to your specifications. Now, if the doctor, you've had your exam, the doctor determines both eyes are pretty much the same, the health of the eye is good, then they may say, well, at this point, all you need is some readers. And they may recommend, okay, go get you a +2. That should take care of what you need, or 250. But they must have, as you said, a comprehensive eye exam first to determine that. But don't go get the readers on your own. Still have an exam. Let the doctor tell you, what you require and if that would be suitable for you and your visual needs. So I agree with that.
Yeah. I did have a doctor tell me I could use readers, but this was only after cataract surgery I had.
Right.
And I still will go to, have those yearly exams, which is important by being a doctor, so.
Oh, absolutely. Annual exam is paramount for you. Yeah. Oh, shout out to the Hampton Roads Alumni Chapter. If you want to join, Virginia, we have a Hampton Roads Alumni Chapter. We need you. So give us a call. We meet the first Saturday of each month, Zoom now. So give us a call, Hampton Roads Alumni Chapter. You've got us on Facebook, so look us up.
Yeah, we have a Facebook page, and Paula is our treasurer. And I like to say all the HBCUs in the Hampton Roads area, make sure you join the alumni and support your HBCU.
Right.
Gave
Yes.
you learning inside and outside the classroom. So make sure
Right.
we back and support our alumni, our HBCU alumni. And
One thing I do want to add, that's
yes,
crucial because I did not know the accreditation of an HBCU is also contingent on the support and the numbers that the alumni give. I didn't know that.
yes,
Oh, wow.
your endowment that the
Yes.
universities have play a big part in money that you get and
Right.
what stake you have in the university world. So
Right.
that alumni support is so
It's
important.
crucial. It is. Affects their school's accreditation.
Okay.
So before we end, Leah, did you want to do Professor Roberts
Yes, I
again?
will be more than happy to, and just all kinds of technical difficulties this morning, but oh, Clarine Baldrick Roberts, a retired associate professor of business education at Norfolk State University. And prior to that, she taught at IC Norcom High School for a total of 33 years as an educator. She's a native of Portsmouth, Virginia, and a product of its public school system, and was graduated from IC Norcom High School in 1948 as the valedictorian. Her college education was pursued at Norfolk Division of Virginia State College and Virginia State College in Petersburg, Virginia, graduating as valedictorian and receiving a Bachelor of Science degree in education. Her further studies were at Teachers College, Columbia University, New York University, and Virginia Commonwealth University, finishing with a professional degree. She's been an active member of Zion Baptist Church for almost 80 years and has been an active member of Alpha Kappa Alpha for 70 years. Should you see Miss Clarine Roberts, tell her that we salute her during this Black History, Woman in History Month. Always Black History Month, but Woman in History Month, okay? Miss Clarine Baldrick Roberts.
Dr. Robinson, well deserved indeed.
Yes, indeed.
Paula, Harmon, Boone, for your participation in our program today, our show today. Really glad to have you back. Just like, just like everything else, the eye health world is always evolving. So it's always something new to share with the people, new technology coming out. but we're gonna always need those optometrists, and
Yes, yes.
especially in our African American community. So really, I really like the fact that you're pushing, trying to get people involved in that area. And Tom, thanks. I guess our next show, you'll be back in Hampton Roads. Am I correct?
I should be, yes.
Yeah.
And once
Well, we
again,
wish you
James, this is a great Truxton reunion.
Yes.
Yes. Truxton
Right.
reunion here.
Welcome,
appreciate that.
Virginia State, Norfolk State, Virginia Union, HBCUs. We all in this
All
together.
here, that's for sure. That's for
Hampton
sure.
City, North Carolina A&T.
Yes. Love for all my HBCUs.
All
And
of them.
congratulations again to the Spartans for winning the MEAC tournament.
Yes. Behold the green and gold.
And
Right.
good luck to them as they go on and try to shock the world again like they did some years back
Some years ago. Yes.
in that tournament. So thanks again for everybody for being here, and we really appreciate it. And we had a lot of technical difficulties today, but those things happen and we move on. But once we get this on YouTube channel, everything should be clear because we recorded it on YouTube. So everything you won't see any of this, the people that were watching on Facebook Live. So we really appreciate you, your support, your continued support. And thank you, everybody. And God bless you. And Portsmouth Coffee Talk is here with our voice.
Our community.
And our future.
We appreciate that. God bless you. Take care.
We're going to get that synchronized a little better soon. Okay. Thank you so much, Paula. It's great seeing you. Please tell the family I said hello.
Now, one more thing to say about VUU.
Pardon?
Oh.
And we're happy to have VUU in the house as well, okay? We're just so happy to see the Virginia Union family here. But my brother's a graduate of Virginia Union, so I have to give him a shout out.
Norfolk State has.
My husband went to graduate of Norfolk State, so we all in this together.
We're all in here together, that's for sure.
That's it, yep.
Now I was gonna say Norfolk State has Behold the Green and Gold. Virginia Union has For Real the Maroon and Steel.
Right, there you go.
All right.
All good.
Y'all almost made it to the maroon and gray, huh?
Almost.
We didn't have to do a lot of changes going from Norfolk. Take care. Thanks again, Dr. Boone, Paula.
Thank you. Thank you for having me.
Thank you. Thank you so very much.
Thank you so much. Thank you.
Bye-bye.
Bye-bye.
Well, let me stop the recording. Wait a minute.